Communication. One-way communication is a command. An example would be the surgeon tells the scrub nurse, "Hand me the number 5 dilator." The surgeon gave a specific order and had no expectation of feedback. An example of two-way communication would be the instructor asks the class a question about the topic being covered. This purposefully prompts feedback or discussion from the students. Personal characteristics of the sender and receiver include age, gender, income, marital status, attitude, etc. Cultural characteristics include space, language, touch, manners, gestures, etc. Situational influences would be physical and emotional state, background noise, interruptions, etc. And context is the appropriateness or inappropriateness of the message. With verbal communication, there are many different ways to interpret a word. So if you, for example, how would you interpret the word trip if I said, "I heard you had some trip"? It could mean a variety of things, so we need to be very careful of the verbiage that we use. Verbal communication is the spoken message. So think very clearly, very carefully before you speak. Speak clearly. Speak professionally. Speak only about what you know. And if you don't know something, let the patient know that you will find out the answer, or you'll find someone who knows the answer. Don't use slang. No medical jargon. For example, things that we assume that people understand because we use them all the time would be NPO or sub-Q or analgesic or arrhythmia, bearing down, purulent. Understand that some clients, due to their age or language barriers or disease process, might take your words literally. With nonverbal communication, examples would be facial expressions, body posture, eye contact, hand gestures, fidgeting, yawning, sighs, shoulder shrugging, physical appearance, and movements. It is body language. It provides clues to the truth of the spoken message and is an indicator of patient discomfort. Again, physical appearance is a part of nonverbal communication. Nonverbal communication pertains to behaviors that are displayed by an individual rather than his or her actual content of speech. A client's body language will tell you a lot about what a client may not verbalize. Affective communication is the feeling or the tone. It is an emission of energy. Many factors can affect a person's mood, such as traffic conditions, availability of parking, the amount of sleep, family situations, the mood of coworkers, hunger, workload. Our attitude is our manner or disposition toward a person or thing, and it's a settled mode of thinking. Our mood is a prolonged emotion that will color one's psychic life. And personal space is an imaginary comfort zone around a person. Truly honest communication will integrate verbal, nonverbal, and affective communication, so they all express the same message. And understand that they can all occur at the same time. The purpose of communication refers to the health-related reason for gathering data or giving information. Disciplined attention means that you do not assume accuracy of information without checking it out. Focus means that all your senses are alert to clues that the patient may be communicating. So communication is far more complex than just the spoken word. Evaluate the characteristics that are working for you and those that you need to work on. With active listening behaviors, let's try and identify the following statements. The nurse states, "In this hour you and I discussed." This would be an example of summarizing. The nurse states, "I am not sure that I follow that." The nurse is asking for clarification. The patient states, "It's a waste of time to talk to anyone." And the nurse says, "You don't think anyone understands?" You are paraphrasing. In other words, you are restating something using different words. The nurse states, "Tell me whether my understanding is the same as yours." The nurse is seeking validation. The nurse states, "Go on. I see." This is minimal encouraging. The patient states, "Should I have the surgery?" The nurse states, "Do you think you should?" This is reflection. You're causing the client to reflect on their statement. Think about what would happen if you try and fill silence with chatter. It may make chaos out of the communication. It may allow clarification, and it may encourage the patient to begin speaking more. Avoid interrupting and doing busy work when the patient is speaking. In other words, give the patient your attention. Open-ended questions permit a variety of responses and allow the client to respond how he wants to. It often begins with words such as what, where, when, how, or why. Closed-ended questions are going to require a specific answer. And focused questions provide more definitive information. In other words, you are exploring the patient's abdominal pain. You ask them about the pain. You ask them where the pain is located. You ask them if anything causes or relieves the pain. You ask them when the pain started. These are focused questions, all designed at trying to come to a specific answer or eliminate information that's not necessary. Additional blocks to communication other than these that are listed here would be giving approval, rejection, agreeing or disagreeing, challenging, testing, defending, requesting an explanation, using denial, interpreting, and introducing an unrelated topic. In conversation, men tend to converse to maintain status, to report, to get information, or to solve a problem. Men tend to be more assertive and use shorter and fewer sentences. Men tend to nod if they agree. Women nod to show attentiveness. Men will hold their heads erect, while women tend to tilt their head to the side or they lower their chin during conversation. When a woman smiles, that does not always mean that she's happy. And realize that men don't always show emotion. And always remember that posture, whether male or female, will communicate nonverbal messages. Think about how a man and a woman might answer the same question in a different manner. And unfortunately, male opinions are often valued more highly without being validated. Patterns of communication might differ between people of the same sex, so it is really important for nurses to ask detailed questions. There is a difference between culture and an ethnicity. Culture is the total way of life of a people, the social legacy of norms and values the individual acquires from his or her group, while ethnicity is an affiliation due to a shared linguistic, racial, or cultural background. Differences exist within each cultural group and range from extremely conservative or orthodox to very liberal and reformed. Be aware of where your client falls in his or her cultural group. With role changes for the patient, remember that a patient who has been highly independent, making their own decisions, in control of their life, etc., when they become a patient, now they become dependent and they may struggle to make this transition. We need to remember when we are conversing with baby boomers that they usually prefer to be called by their first name, but we should always ask. People will change roles when they become a patient, and again, you need to realize that this will have a bearing on communication. Respect gives a patient a sense of worth. You should never make up an answer if you're not sure of it. Always be honest. Let the patient know that you don't know, but that you will return with the correct answer, and then make sure that you do return. When you're sympathetic, as you should be with a family member or dear friend, you are actually experiencing the emotion that the family or friend is. Think about when humor is not appropriate in communication. A lack of patience with a patient can lead to increased anxiety on the patient's part. As far as commitment, you need to think about why you are really in nursing. Self-esteem is earned, it's not learned. It gives you permission to recognize that you have something very special to offer in nursing communication. Random thoughts usually pass through unless you pick a thought and change it into an active thought. If your thoughts are not serving you, then change them. Thoughts also will set the tone for how you communicate with patients and other staff. Be direct in your conversation and don't talk just to fill silences. Each group has different communication needs and communication patterns. With infants, their cries have different meanings, and they can be influenced by the sound of the voice. Infants tend to respond to calm, low tones, although newborns under a month old will respond better to high-pitched rather than low-pitched voices. Preschoolers cannot verbally express frustration, and this is what leads to their tantrums. They often communicate by pointing, but they can help do things if they are coached. So during procedures, explain briefly and simply what's going to happen and tell them what they can do to help. With school-age children, they can be part of many discussions. They often use drawings or pictures to explain an illness. Validation of the school-age children's perceptions is very important. And remember that younger children think pretty good in the afternoon hours. The teenager, you need to extend the same courtesy to them as you would to an adult and encourage expression of their feelings. Don't use teen slang because it usually doesn't work out. Without real knowledge of the meaning of their slang, you may end up appearing foolish instead of cool. With the adult, collect data at all three communication levels: verbal, nonverbal, and affective. Limit questions to medical areas. Written information seems to be more neutral and does not evoke the emotional reaction that words have. With the elderly, make sure that you check which side might be better for them to hear you if they have a hearing issue. Read the directions aloud. Be aware of a possible diminishment of their senses, such as hearing or cognitive or visual. Make sure that you use a matter-of-fact yet gentle approach, and do not patronize or talk to them as if they're children, because they are not. Include the elderly patient in communication even if family members are there. With conflict resolution, understand that conflict can be related to diversity. English is a second language, differences in gender, generation, and personality. Conflict is a natural part of life. Additional email tips include answering swiftly, answering all questions, and by doing that you will preempt further questions. Don't attach unnecessary files or overuse the high priority option. Don't copy or attach a message from someone else without permission. Don't use email to discuss confidential information. And make sure that you keep your language gender neutral. You should also avoid using urgent and important. And although we do not recommend having cell phones during clinical or class time, we do understand that smartphones are very useful in the workplace. They can provide interpretation, they can help with researching a topic, looking up information, etc. Just make sure that it is used appropriately, because it can be held against you in a court of law.